Hello, friends. If you were born before 1966, I need you to stop whatever you are doing and watch this entire video. Because what I am about to share with you involves 5 real government payouts that hundreds of thousands of American seniors qualify for right now, and most have never claimed a single dollar. These are not rumors. These are not loopholes. These are real programs built into the Social Security system, the Medicare system, and federal benefit law. Programs that were designed specifically for people your age and in your financial situation. The problem is nobody told you about them. The SSA does not send you a letter. Your doctor does not mention it. The government does not advertise it. And that is exactly why I am here today. Stay with me through this entire video because number 4 on today's list is one that most people, even financial advisors, have never heard of. And the amount of money sitting unclaimed in that program right now will genuinely shock you. Before I begin, if you have not yet subscribed to this channel, please click subscribe right now and hit the bell icon so you receive every alert we post. We publish new information every single day, and the people who subscribe are the people who never miss money that is owed to them. Now let me tell you why this information is so urgent in 2026. Every year, the Social Security Administration and related federal agencies carry billions of dollars in unclaimed benefits on their books. These are payments that qualified seniors simply never applied for, either because they did not know the program existed, because they assumed they did not qualify, or because the application process seemed too complicated to navigate alone. But here is what you need to understand. These programs do not expire silently. The money accumulates, and in many cases, when you do finally apply and are approved, you can receive retroactive payments going back months or even years. That means the longer you wait, the more you may be leaving on the table. But it also means there is still time to claim what is yours. If you were born before 1966, you are in a very specific group that the federal government has repeatedly passed legislation to protect. Because people your age built this country, paid into these systems your entire working life, and are the most likely to be living on a fixed income in 2026. These 5 payouts were designed for you. Let us begin. Payout number 1, the Social Security Benefit Recalculation Credit. Most people believe their Social Security benefit is locked in the moment they start collecting. That is not true. And for seniors born before 1966, there is a specific recalculation process that can permanently increase your monthly check, in some cases by more than $200 per month. Here is how it works. The Social Security Administration calculates your benefit based on your 35 highest earning years. But many people, especially those who worked part-time in later years, took time off for caregiving, or had low-income years on record, have 0 or near 0 earning years that are dragging down that average. What most people do not realize is that you can request a formal benefit recalculation at any time by calling SSA or visiting your local office. If you worked any additional years after you started collecting benefits, even part-time, those earnings may replace a lower earning year in your record and push your monthly payment higher. The SSA is required by law to apply this recalculation, but they will not do it automatically. You have to ask. In 2026, the average increase from a successful recalculation for seniors in your age group is estimated between $84 and $230 per month. Multiply that by 12 months and you are looking at over $2,700 per year, every year for the rest of your life. If you have worked at all since you started collecting Social Security, or if you believe your earnings record may have errors, call SSA at 1-800-772-1213 and request a benefits recalculation review. It costs you nothing. It takes one phone call. And the money, if they find an increase, is permanent. Payout number 2, the Medicare Savings Program. 4 levels. Most seniors only know one. If you are enrolled in Medicare, you may qualify for one of 4 Medicare Savings Programs that can dramatically reduce or completely eliminate what you pay for premiums, deductibles, and copays. Most seniors have heard of only one of these programs, the Qualified Medicare Beneficiary Program, or QMB. But there are 3 additional levels that cover people at higher income thresholds, and in 2026 those income limits were adjusted upward, meaning people who were previously denied may now qualify. Here are the 4 levels you need to know. The Qualified Medicare Beneficiary Program, QMB, covers your Part A and Part B premiums, deductibles, coinsurance, and copays. If you qualify for QMB, providers are not legally allowed to bill you for Medicare-covered services. In 2026, The income limit for a single person is approximately $1,064 per month. The Specified Low-Income Medicare Beneficiary Program, SLMB, pays your Part B premium, which is currently $174.70 per month for most enrollees. For a married couple, that is $349 per month back in your pocket. Income limit for a single person, approximately $1,274 per month. The Qualifying Individual Program, QI, also covers the Part B premium and is funded on a first-come, first-served basis each year. Income limit for a single person, approximately $1,426 per month. The Qualified Disabled and Working Individuals Program, QDWI, covers your Part A premium for people who are still working with a disability. To apply for any of these programs, contact your state's Medicaid office, not Medicare and not SSA. Many seniors call the wrong agency and give up when they are told to go elsewhere. Go directly to your state Medicaid office or call 1-800-MEDICARE and ask them to transfer you to the Medicare Savings Program enrollment line. Payout number 3. The Social Security Lump Sum Death Benefit and the survivor benefit calculation most widows get wrong. If you lost a spouse and are currently collecting Social Security, there is a very high chance that you are receiving less than you are legally entitled to. This is one of the most commonly miscalculated benefits in the entire Social Security system. When a spouse passes away, the surviving spouse is entitled to receive the higher of the two Social Security checks, either their own benefit or their deceased spouse's benefit. Most surviving spouses know this basic rule. What most do not know is the specific timing rule that determines how much of the deceased spouse's benefit you receive. If your deceased spouse delayed their Social Security past their full retirement age and earned delayed retirement credits, you, as the surviving spouse, are entitled to the full amount your spouse was receiving, including those credits, at the time of death. But SSA does not always calculate this correctly on their own. Studies have found that surviving spouses are underpaid on survivor benefits at a rate that affects hundreds of thousands of people. If you are a widow or widower born before 1966 and you are currently collecting a survivor benefit, I want you to request a survivor benefit recalculation from SSA. Ask specifically whether your deceased spouse had delayed retirement credits applied to their benefit at time of death, and confirm that your current survivor benefit reflects the full amount, including those credits. Additionally, there is a one-time Social Security lump sum death benefit of $255 that must be claimed within 2 years of death. Many families miss this deadline entirely. If you recently lost a spouse and have not claimed this payment, do it today at ssa.gov or by calling 1-800-772-1213. Payout number 4, the Extra Help Program, and the automatic enrollment gap that costs seniors thousands. This is the one I promised you, and when I tell you how many seniors are missing this, I want you to share this section of the video with every person you know. Extra Help, also called the Low Income Subsidy, or LIS, is a federal program that pays for most of your Medicare Part D prescription drug costs. And I mean most. We are talking about premiums, deductibles, and co-payments on prescription drugs, reduced to nearly zero for people who qualify. In 2026, Extra Help can save a qualifying senior an average of $5,560 per year on prescription drug costs. That is over $460 per month in savings. Here's the problem. The Social Security Administration estimates that approximately 2 million Americans who qualify for Extra Help are not enrolled. 2 million people. That is 2 million seniors paying hundreds of dollars every month for medications they should be receiving at almost no cost. Who qualifies? In 2026, if you are single with annual income below $22,500 in limited assets, you likely qualify. If you are married with combined annual income below $30,000 in limited assets, you may qualify. Assets do not include your home, one car, personal belongings, or life insurance. Some people are automatically enrolled in Extra Help if they qualify for Medicaid or a Medicare Savings Program. But millions more fall into a gap. They qualify, but they are never automatically enrolled because their income is above Medicaid limits, but still within Extra Help limits. To apply, go to ssa.gov/extrahelp or call 1-800-772-1213. You can also apply through your state health insurance assistance program called SHIP, which is a free counseling service in every state. If your prescriptions are costing you more than $100 per month and you are living on Social Security income, please apply for Extra Help this week. Do not wait. The savings are immediate upon approval. Payout number 5, the Veteran's Pension, improved pension with aid and attendance. If you served in the military at any time during a period of war, and for people born before 1966, that includes World War II, Korea, and Vietnam, and you are now 65 or older and need help with daily activities, you may qualify for one of the most generous and most overlooked benefits in the entire federal system. The Veteran's Pension with aid and attendance can pay a single veteran up to $2,318 per month. For a surviving spouse of a veteran, it can pay up to $1,491 per month. These are 2,026 figures. This benefit is not just for veterans who were injured in combat. It is for veterans and their surviving spouses who now need help with daily living activities such as bathing, dressing, feeding, or managing medication. You do not need to be receiving care in a nursing facility. Many qualifying recipients live at home with help from a family member or home health aide. The income and asset limits for this program are higher than most people expect, and there are legal planning strategies, completely within the law, that can help some veterans qualify even if they believe their assets are too high. To apply, contact your local VA regional office or visit va.gov. I also strongly recommend contacting a VA-accredited claims agent or Veterans Service Organization, such as the American Legion or VFW, for free assistance with the application. These organizations exist specifically to help veterans and their families claim every dollar they have earned. Now let me bring all 5 of these together because I want to make sure you leave this video with a clear action plan. Number 1, call SSA at 1-800-772-1213 and request a Social Security benefit recalculation, especially if you have worked at all since you started collecting or if you believe your earnings record may have errors. Number 2, contact your state Medicaid office and apply for the Medicare Savings Program that matches your income level. If you are paying Part B premiums right now, there is a real chance you should not be. Number 3, if you are a widow or widower, request a survivor benefit recalculation from SSA and confirm that your deceased spouse's delayed retirement credits were applied correctly to your current benefit. Number 4, apply for extra help at ssa.gov/extrahelp today if your prescription drug costs are more than $100 per month and your income is below the thresholds I described. Number 5, if you are a veteran or the surviving spouse of a veteran who served during a period of war, contact the VA or a Veterans Service Organization about the improved pension with aid and attendance benefit. Now here is the most important thing I want you to understand. None of these programs require you to be poor. None of them are charity. You paid into these systems. You or your spouse served this country. These benefits are not a gift. They are what you are legally owed. The only reason you may not have claimed them yet is that nobody told you about them. But now you know. And now you have a responsibility to yourself and to every senior you care about to take action. Share this video right now with your spouse. Share it with your siblings. Share it with your friends from church, from your neighborhood, from your community. There is someone in your life right now who qualifies for one of these 5 payouts and has no idea. Your share might put thousands of dollars back in their pocket. Click the subscribe button and the bell icon right now so you never miss an alert. We post new information every day because the rules and limits change, and we make sure you always know first. And if this video helped you, please hit the like button. It takes 1 second, and it helps other seniors find this information. This is your money. Go claim it. We will see you in the next video. Hello and goodbye, friends.